In a continuous suture, begin as for a simple suture. Instead of cutting off the suture, get your assistant to hold on to the end of the suture. It is important for your assistant to maintain correct tension on the suture as well as to hold the suture such that you have enough slack to work with. Place the sutures again and again without tying each individual suture. To minimize handling of the needle, re-grasp the needle as it exits the wound with the needle holder. Note that your hand is in the prone position when you re-grasp the needle. Pull the needle out using a supination movement, recreating the arc of the needle. Rotate the needle holder in your hand so that the needle faces the correct way for the next pass. To do this, it is easier if you hold the needle holder in the palm grip fashion. Look at the movement of the hands again. Needle-driven wound in a supination movement. Pull out the needle a bit with hand in prone position. Re-grasp your needle. Pull the needle out completely by a supination movement. Needle holder is then rotated to reorientate the needle point. Continue in this fashion until you reach the end of the wound. Remember, it is important for your assistant to maintain the correct tension on the suture at all times. To end the suture, leave a loop towards the end and tie a knot. The continuous suture is faster to perform than interrupted sutures and is useful to help stop bleeding from the skin edge, for example, in a scalp laceration. However, removing any one suture unravels the whole suture.